الحمد لله الحمد لله وحده والصلاة والسلام على من لا نبي بعده أما بعد فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المهتدون. Allah subhanahu wa ta'ala in this particular surah Al-Baqarah and 3 ayat of those which are recited most often at the time of calamities and difficulties, mention that, and we will surely test you with something of fear and hunger, and a loss of wealth and lives and fruits. But give good tidings to the patient, who, when disaster strikes them, say, indeed we belong to Allah, and indeed to Him we will return. Those are the ones upon whom are Allah's blessing and mercy, and it is those who are rightly guided. May Allah make us all from among those people. Ameen Ya Rabbal Alameen. So let's start with our talk on coronavirus. The pandemic of that has been ongoing for the last 3 months or so. So it is called corona because it has a shape like a crown. And if you start looking at the data from world around, you would notice that it all started in Asia, where Wuhan and China was the main epicenter, and it started traveling mostly towards the west, and now Europe is the epicenter for this particular disease. The bigger the circle, the more crowded the place is with infected people. So now Europe is the main center, with Italy being really the hub of the infection, and it is spreading further up. To date, as of 22nd of March, we have confirmed cases of about 300,000 people worldwide, out of which 13,065 people have already died. If you look at the trend, this is how exponentially it is moving up. It started off slowly, and then if you look at the trend, which is confirmed cases line going all the way up now from March onwards, or even from February, but from now onwards it has gone further up. And remember, this is reported cases and confirmed cases, and there are many who would be having the bacteria but not being reported or confirmed through not having the tests. So, which means that this is actually an underestimation of the true reality of the picture. If you look at on a daily basis, this is how it's going. And so we're still on the rise. In UK, as of yesterday, we had about 1,500 patients just in London, confirmed cases. Now look back, since we are in Europe at the moment and Italy being the epicenter of that, where we are with regards to Italy, it looks that we are actually not too bad. We are doing okay because Italy is really going up there, yet UK, which is in green color, is really holding on at the moment, but this is as of yesterday. Likewise, the death toll is following the same trend. Again, one may feel that, oh, we are doing quite okay at the moment. But when you compare with some other countries, particularly in this case, Pakistan, so Pakistan is green now and we are blue in the UK. You see, this is exactly the same trend. So we are actually, with regards to Pakistan, doing as Italy is doing to us, which means Italy is only about certain days ahead of us, and we are following the same trend. People who are infected, people who are dying, we are following the same trend. Again, these are reported cases. There may be many more which are gone unnoticed. And if you look at the Western Europe data, you would find this dashed line at the top suggests that if your graph is following this top line, that black dotted line with the dot intermittently put as well, then you have 35% increase on a daily basis of the cases infected with this particular virus. And if you are on broken line further down and you're following that trend, which most of the countries in the Europe are actually following on this graph, then you have about 22% daily increase in the number of patients that you're seeing. So it's actually going straight up at the 45-degree angle. Same here. If you look at the data, this is what we are doing. Now, obviously, China is coming to a plateau. We start seeing a downfall in the number of patients getting infected. And as of yesterday, they had no, in fact, day before yesterday, there was no case reported in China, which means that they've already gone over that and they are now plateauing. And the patients who have already been infected, they would start getting better and better, and they would be left with no virus there, hopefully at some time in near future. So this is where the trouble is. This graph actually shows one more important point, which is what Japan, look at Japan, which is the bottom one, that orange one. They have managed to get out of that main trajectory. So they're actually going further down, not at a 45-degree up incline, rather they are a bit more stunted, and they're managing to reduce the number of patients on a daily basis, really, which is quite good. Here you would see many more countries, some going in the footsteps of Italy and Europe, while others are slightly on the lower side. Now, if you look at USA and France, you could see that their trend now is going up. Particularly USA, the magenta color is actually going even on the left side to the previous or original curve, which is China line. So the black line going up, we are in USA actually going further back, means that we are actually getting more patients at a shorter interval or quicker. That's actually suggesting a big spread there as well. So that's a disaster. Now, South Korea and Japan managed to keep it very low through their good measures earlier on, which is in a way a very good news for them. But we need to see how they're doing in future. Here you look at Italy again, which is the magenta color, purple color, and we are in USA 17 days behind Italy. So look at that orange line. We are following the trend, but we are about 17 days behind. So in 17 days time, we will be where Italy is. And these are the number of cases on the left side, left-hand corner, you could see that long line. We call it x-axis. So if you look at that, it is actually showing the number of cases per million. So look at Pakistan here, which is orange color. We're here at the moment, but our angle is straight up, as if it is going to hit straight. If we do not take immediate measures now, we will hit straight up there to 35% or even more increment in the number of patients on a daily basis. And this is very scary for the country like that. So we have to be extremely cautious and careful about what we know and what we are doing. It is not a myth. It is just the data of the patient that we have got is completely proven scientific data behind it. These are just the number of cases on the registry. Now, there may be that many more patients are hiding, especially in third world countries, and we would never know what's happening to them, but they would only increase the burden of the disease. So looking at those graphs, you must have already started thinking what's going to happen. So this is what would happen. People would just go up, like the number of cases would continue to rise till we come to a peak, and then we start going down. Now, China has already done that. China is coming down here. Italy has not quite reached the peak, which means there'll be a few more days or however many days before it starts coming down or staying on plateau and then coming down. The idea is that we need to flatten this curve. The reasons are manifold, but most importantly, if you do not, then you would have many more patients requiring medical help. And with the current trend worldwide, there's no system that can cope with the number of patients that we are anticipating would need medical help. So the capacity is way beyond full. So we haven't got any capacity in any country, to be honest, to cope with all these sick patients who would need ventilators, oxygen, and different support, side rooms, properly covered and isolated bays and cubicles. It is almost impossible if we do not stop it here. So what is COVID? So COVID-19, because it started off in December 2019, that's why it's called 19, is a part of coronaviruses. So coronavirus is the common cold virus, flu virus. These are all coronavirus family. And they have got 4 more widely used ones. If you remember SARS and MERS, they are the same family. SARS, which is severe acute respiratory syndrome, and MERS is Middle Eastern respiratory syndrome. They happened in the past, and I will give you a bit of detail about them, so get a bit of historical background to them. This is the same virus as SARS, very closely related to SARS, same family. So that is why that SARS was called SARS coronavirus, SARS coronavirus. And this one is called SARS coronavirus 2, because this is number 2. So this is what happened in the past. So SARS coronavirus, we can call it 1 now, or just SARS for the sake of ease or simplicity. That happened in 2002 to 2004. So during that time, it started off in China again. 8,000 people were affected, and 774 people died through that, about 9%, 10% mortality, which was very significant mortality. But since 2004, there has been no further cases of SARS, as if it is not there anymore. Now, H1N1, if you remember, swine flu, that was in 2009-2010 period, and it started off in Mexico, and it affected 61 million people worldwide, and 500,000 people actually, and more than that, actually died, which is about 1% mortality. So many people got affected by that, but 1% of them died. Now, this H1N1 is a swine flu, but it comes in different shapes and different styles every so often. MERS is again coronavirus. It was in Middle East, and they still got small breaks here and there ongoing at the moment, few hundred cases on a yearly basis, and they're milder relatively. But when the pandemic happened, and pandemic means the disease has gone beyond any limited area, beyond any boundaries of the countries or cities. It's actually gone everywhere. So in 2012, when there was the pandemic of MERS, they had about 2,500 people affected with that, and 800 people plus got dead. So 36% mortality, very high mortality, highly virulent, and very uh, significant problem at that point, if you remember. And then this particular virus again started in Wuhan, as we know, SARS-CoV-2, and we call it COVID-19. About 30, 300,000 actually, 300,000 plus, so 3,100. So that's a lot, 1,000 patients. 3,000 already are affected by that, and it's exponentially rising. And about 13,000 patients had already died of this condition. So this mortality, as of now, is 4% or so, close to that. And now you would say this is less than SARS-CoV-1 and also MERS, but hang on there, because that was a duration of 2 years for that and about a year or more for this one. And this SARS-CoV-2, the mortality that we are seeing is just within 3 months. In 3 months, you already reach up to 13,000 deaths. So this is why we need to be very careful. The number of deaths would be very, very high compared to even MERS, which was 36%. But you could see that there was only 2,500 patients worldwide. So not a huge number of people got affected by that. So obviously, significant mortality. It was a very bad virus, but has not affected the whole world like this. It was contained. It was sorted out earlier on. So from all those respects, this particular virus is a biggest threat that we know of at the moment. So what it does, it has a property whereby it just gets stuck to the cell wall and start breaking it and sending its DNA into the host cell, and that host cell start multiplying it. So as if it injects its own material just to get it multiplied, so to say that it actually bed with this particular cell in the body, and the body then, those cells would then consider it to be a signal to say that we need to multiply it, and they start hatching the babies. And those babies, when they multiply inside the cell itself, they then cause the death of the cell from inside, and then they get dispersed out into the blood. And that cell, when it's dead, it actually causes many other viruses to spread in the blood. So you actually causing yourself a bit problem by that, and this is how it works. It's a very, very nasty way of causing trouble to humankind or any organism, to be honest. It causes two problems. So it has a property of causing trouble to the lungs and also trouble to the heart. And that is more for medical professionals, not for common man. But just remember that there are two organs, actually kidney as well, get affected later on because of the rubble and the debris and waste products created with that infection and fight, and bodies trying to fight the infection off, and there's a lot of chemicals being poured out to fight it off, and this big war carries on, and then lungs get completely filled up with all those debris and material which needs to be cleared, and the patient cannot then breathe. And once they come to that stage, they become very, very unwell. And that's when they need some oxygen, hospitalization, intubation, and if they survive that episode while the body is resting on the machine, I mean the lungs is resting on the machine and getting enough oxygen for the body to function properly, then lungs start taking over the bacteria, and the body would then become overpowering the bacteria, controlling it and killing it. But that takes time, up to 2 weeks or so. So that's a normal way the bacteria or the virus, sorry, in this case, attacks the body. Now, is flu not the same if they're same bacteria or same virus? So should they not be exactly the same? So the answer is they have got some similarities, but they also have some differences as well. So I would just give you a quick summary of that. If you look at this particular chart, you would see normal flu with this virus, rhinovirus or coronavirus. When you get that infection or inflammation, you start off having the symptoms within a day or maximum up to 4 days. But the infection that we are talking about, the COVID one, it gives you about from 2 days to up to 14 days. And then it will be very, very difficult for people to know when the actual disease started inside the body, because there is this long period where sometimes even a week goes and you would not know whether you have infection or not. And then you continue to spread that virus in your cough, in your sneezing, your spittles, and when you have vapors through your breathing, any secretions of the body from the mouth, they come out and you're passing it on to others. So the spread of flu likewise is slow. The spread of COVID-19 is very, very fast. It's up to 75% people of the whole world would get affected by this. This is anticipation. It's very, very fast growing. And likewise, most people would just have mild disease, even moderate maybe. Sometimes they need 2 or 3 days, but they would get better very soon, very quickly. So 99% of people would have no issues. Only 1% of people with flu would have severe disease, and sometimes they can become unwell, requiring hospitalization, secondary bacterial infection, and then get more support in ITU. But even then, they actually survive. Only 1 in 1,000 patients would die with flu. Whereas, if you compare that same with COVID, this coronavirus, the disease is very severe in 20% of patients. 80% of people would have no trouble, but about 15 to 20% of people would have a very severe disease. It is 10 times more lethal, which means it would kill about 2 to 5% of people as of now. Or you could imagine the number of people who get flu is about 3 to 5 million per year, and they still get over it because this is milder disease. And COVID is much more severe and serious disease. Again, this diagram shows the difference, the mortality and the cases both ways. So this one is the cases. How many cases do we get on a yearly basis? So this is the blue line at the bottom is SARS. The green one is swine flu. This is how it goes. It went then on a 100-day period. Whereas whatever they achieved in 100 days, we have by 70 days, we have achieved that much, in fact, much more than that. So the number of patients that we have now is more than 300,000 patients. This is a couple of days old data. And likewise, deaths. So we further up into 13,000 deaths. This is 2 days old data. Within 70 days. So what other conditions achieved in 100 days, we have done that in 70 days. So this is how fast this is. So what is the case fatality rate, which means how would it be with regards to the age of patient? So if you are a small child under the age of 14 to 16 to 18, these people would have very little problem. They would go through it as if they got some mild cold, and they would be fine. Most of them would have no trouble at all. But the problem is they would pass on to everyone else in the household, at school, at the park, shopping mall. And that is the rationale why we suggested stopping or closing the schools down. Why government say that there should be no schools, and some countries have already taken that on board, and we have done that as well in the UK, and it's actually quite good measure because kids though would not have any significant trouble, but they would be bringing those bacteria, those viruses back home. This bacteria, I keep saying bacteria, it's not bacteria, it's a virus. They would keep bringing it home, and they would affect everyone else because they can't do enough cleaning. It is very difficult for children to stay clean, as you would imagine. Now, those who are under 50 years of age, only 1 to 2% mortality. Means out of every 100, there'll be 1 or 2 people dying of this particular disease. You continue to age from 60 to 70, 4% of people will be dead. 70 to 80, 10% of people will be dead. And more than 80 is about 15%. It's a very, very high mortality for grandparents and elderly people. And there are other people who are at higher risk, like people with diabetes, people who have high blood pressure, those who have lung disease like COPD, smoking related lung condition, emphysema, those who have scarring, interstitial lung disease, those who have bronchiectasis, damaged lung, scarred lung, and likewise those who have coronary artery disease, which is the arteries getting narrow, and this is because of high cholesterol level, having some uh, genetic problem with that, having family history of strokes and heart diseases. So they are the one who either have stents put in or they had bypass done in the past. So these are the very people who be very high risk. So they need to be a bit more cautious about this. How does it transmit? So it normally gets transmitted through the large droplets. When you sneeze as a patient, when you cough, the droplets would come out and they can go up to 6 feet. And that is the rationale behind suggesting if you have someone who has this condition or if you have that condition, you should have this particular mask, which is normal, simple surgical mask. Put that on. And when you sneeze with that, it is not going to go 6 foot away. That you can keep it there. And that is the rationale. So if you have infection, this is the one that you would want. And there's another method, another way that airborne transmission can happen as well. So airborne transmission, but this is controversial. Not everyone believes that. But what it means is when you sneeze out or when you cough, the small droplets, as opposed to the big one, which would just go away and then stay in air for some time. But the smaller one tend to stay for longer period. Rather than landing on some surface, they would stay in the air for longer period. So does it really happen with this or not? That's debatable. But I think there's data to suggest, and it's sensible to consider that due to the high virulence, high infectious nature of this particular virus. So this particular mask is called FFP2, and in America you call it N95. This mask would filter out even the small droplets, small airborne droplets. So we want to avoid that plus this. So for doctors who are dealing with patients, this is the mask they should have. But there's one another particular thing which is very specific to this particular virus, which is what we call contact transmission. Means any surface that gets the virus tend to make a film on it. So you cough, it lands on your mobile phone, it lands on this computer mouse, it lands on your clothes, your glasses, your toilet sink, your car wheel, wherever. Then it stays there. Unlike other viruses that would die due to drying, due to change in weather, they wouldn't stay there for long. But this particular virus can stay up to 4 to 7 days. And every time someone touches that particular surface with the virus on, would get infected or would get that virus on their hand. And then what would happen? You touch your eyes, you touch your nose, you put hand in your mouth or wherever, you scratch here and there. So any mucous membrane, any soft membrane, as if you have whatever you have inside the mouth, for example, or eyes inside of the eye, that soft membrane, the virus can seep through that inside our body. So that is why we are suggesting that people shouldn't be putting hands in their eyes, nose, and mouth. Rather, they should be washing their hand day in, day out, every so often. And that is not being crazy. It is just the nature of the disease, and we have to break this particular chain. If we do not, there'll be significant problems. So how can you break that chain of transmission? Because virus is multiplying from 1 to 2 to whatever. We come to that in a second. Regular cleaning, as I mentioned, of the surfaces as well. So 70% ethanol or sodium hypochlorite or anything like that would help. Bleach or whatever you have to clean, but clean it. Hand hygiene is extremely important, very important, with soap, and ideally use it for more than 20 seconds. If you have had some significant dirt or unclean hand, then definitely do it for 20 to even 30 seconds. And then, unless you have done that, try not to touch your nose, your mouth, your eyes, so as to avoid any transmission of the virus. Now, some people may ask, the ethanol is alcohol, and obviously it's najas, it's impure, we can't touch it. But there's difference of opinion on that. In Hanafi school, Imam Abu Hanifa rahmatullah alayh, they would suggest, the fuqaha of the Hanafi school, that since this is a synthetic alcohol, it is not derived from dates or grapes, one can use them. And obviously this is a dire situation. If one do not have anything else, they can use it. We can take that fatwa from Hanafi school, and this is what scholarly sayings meaning اختلاف أمتي رحمة, that اختلاف أمتي رحمة, the difference of opinion among my ummah is a blessing. Blessing in a sense that had it been just one view, would have been in trouble whether we can use it or not. Now, inshallah ta'ala, we can use it. So, as I mentioned before, if you contracted this virus through touching something, or someone sneezed on you, or something landed on some surface and you touched that, and then you rub your eyes and you got the virus inside your body, you can stay asymptomatic. It will never show up any symptom at all. So a very mild cough, very mild, maybe temperature, feeling just slightly lousy for a day or so, you'll be completely fine after that as a normal cold symptom. But up to 8 days, it can continue to be transmitted. You can still shed viruses in your cough without you having any trouble. So that is why the trouble is that the minute you start getting symptoms, you would know what's happening. But if you do not have symptoms, and when would you isolate yourself? You wouldn't. How would you know? You're completely fine and well, man. Why should I stay away from everything else? And that is why we're saying whatever you do, limit your contact with people. Do not do anything which is not necessary, because you would not know the person that you think is completely fine and you shook hand with him. He happens to have that cough, or someone from the family had it, or someone at the workplace had it, and you happen to be with them, and then you had it for next 5, 6, 7 days without any trouble. You are youngish, you've got about good health and no trouble at all. So you would continue to harbor that particular virus, COVID-19, and you would continue to infect other people around you, especially your household. Obviously, children would be able to sail through it without much trouble, inshallah ta'ala, but your elderly parents, someone sick in the house, someone who has, God forbid, cancer, someone who is pregnant, someone who has dialysis going on for kidney problems, someone who has diabetes, someone who has strokes and other conditions, someone who's bedbound, someone who's very elderly, all those people, someone who is on chemotherapy, taking some immunosuppression for skin condition, lupus, and many others. They are the people who would be vulnerable and would get infection, and these are the very people who would succumb to death if they are not treated in timely fashion, and even then they will be in trouble. Now, this R naught is a number that we look at. It means that it suggests the number of people, average number of people that a particular individual would infect during the time that he has got the virus. So if, say, person A has virus, COVID virus, yeah, how many people would he infect? So if it is less than one, then automatically the disease would be contained, and it would definitely come down to N very quickly. It cannot last very long because there aren't enough recruitment happening from the virus. Virus is not multiplying at a proper rate according to this particular virulence that it has, which means that it would just come to an end very quickly. It would be possibly self-contained, only few people would have it. If this R naught is 1, which means each infected person would infect at least one. So this would remain at a low level, same number, one patient gets cured, other person would be still there. So you would never have a number up or down. There would be small grumbling up and down, a little bit here and there, not much difference. So that is not a bad thing compared to what is going to happen with COVID, which is that each individual that has virus would infect up to 3 people before it gets cured or it kills the host. So 3 people per person. You could imagine one person has it and he's going to infect 3 other people before he gets cured. He might not ever have any trouble with that, but he would make other 3 people, and those 3 people would go to 3 each. So from 1 to 3 to 9 to 27, you could imagine how it's going to multiply, and it'll be very, very quick. That is why it started off taking a proper, start from, I think, mid-January, and here we are within 2.5 months to 3 months, maybe maximum. The whole world is concerned about the problems. About 169 countries already affected by this particular illness, and it's ongoing. It's not stopping anywhere. So, what is the situation in poorer countries relatively? So, this is the problem with the virus, but what causes more trouble? In poorer countries, cash economy. We use notes, bills. We do not have much credit card, debit card system, although it's there, but not widely used. People use notes and bills, and they pass on to others. What's going to happen? You would always have it with you. You always take it out. There could be 10 people touching that particular note before you get it. So what is the chance of having a virus sitting there? Very high. And people living together. So in, for example, India, Pakistan, Bangladesh, you would find people living together. And younger generation, they are fine. They are not going to stay indoors. They don't find enough space. They have to go out to play. They would go out. They would consider school ban or school closure to be a fun time. Small kids or boys, girls, they would go out. They would infect each other. They would get mild disease in maybe a week time, but they would pass those bacteria, viruses, or whatever they have, and including this particular COVID virus, to parents and grandparents indoors. So in poorer countries, the death rate would be higher compared to the data I just showed you. It's about 4% anticipated in over 50, although it was between 1 and 2% for other countries. So almost doubled, which means that almost every household would lose one person. So you imagine that in the next 6 weeks to 8 weeks time, we would be talking, if we were alive, we would be talking, inshallah ta'ala will be alive, we'll be talking about who we lost in our family. And likewise, in poorer countries, you would see there are very few ventilators available, and those hospitals that have it, they don't work properly because they're not being used that frequently. And how many doctors, nurses would be trained to use those ventilators properly? Obviously, intensivists would be fantastic. They know how to deal with that. But this is a problem where ICU team would do. But ICU in every country would be just taking care of only few patients. They do not have capacity. So how many people are trained to use it, to do it? Then if we do not sort it out now, there'll be big trouble ahead. Now look at this one. This is a prediction. There is a concern that if we did not do anything, let the virus go, natural history. So the black line is you do not do anything, no mitigation, no care at all. People just say, you know what, we're not going to stop. We do the way we want to do. It's all from Allah subhanahu wa ta'ala. قدر الله ما شاء فعل. And ما أصاب من مصيبة في الأرض ولا في أنفسكم ما أصاب من مصيبة فبما كسبت أيدي الناس ظهر الفساد في البر والبحر بما كسبت أيدي الناس. So people would think on those lines, which is obviously part of our faith, and we know, alhamdulillah, Allah subhanahu wa ta'ala tests us. Allah subhanahu wa ta'ala sends whatever Allah wants to send, and we stay patient. Whatever is written, that happens. But we need to be careful about the instruction from Allah subhanahu wa ta'ala. Allah subhanahu wa ta'ala asks us to be prepared. So Allah says, وَأَعِدُّوا لَهُمْ مَا اسْتَطَعْتُم مِّن قُوَّةٍ. Prepare yourself for all the ability that you have. Utilize it to gather all your armaments. Rasulullah sallallahu alaihi wasallam was asked about tawakkul, having trust in Allah. Well, O Messenger of Allah sallallahu alaihi wasallam, do I tie my camel and have trust in Allah, or do I just leave it and have trust in Allah subhanahu wa ta'ala? Rasulullah sallallahu alaihi wasallam said, tie the camel and then have trust in Allah subhanahu wa ta'ala. I'qil al-jamal. First you tie the camel. So this is what we are doing. We are not doing any of that in order to obviate or in order to prevent anything that Allah subhanahu wa ta'ala has destined. Or we know that Allah subhanahu wa ta'ala would do whatever Allah would want, but Allah subhanahu wa ta'ala wants us to do certain things in order to prevent all that. So we are doing what we should be doing. Alhamdulillah, we know that Allah subhanahu wa ta'ala would help us with the cure as well. Why we know that? Because Rasulullah sallallahu alaihi wasallam mentioned, never does Allah send a disease except that Allah subhanahu wa ta'ala would send its cure. So we inshallah ta'ala will have the cure for this as well. Anyway, so if you look at that, so black line is if you leave it the way it is, it would just go up, 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 up. It will kill many, many, many people, and then would naturally cut down and come out and gradually will be gone. So from, say, early, we're just going in spring and summer and then autumn, it would just go like that. If we did something, some help, some support, we just tried to do a little bit. We closed school, for example. We have closed school in Pakistan way earlier. Japan and Taiwan, actually, they did way early in end of January, early February, they closed their schools. And they did quite good job there as well. So if we did all those measures, we cut it down to this blue graph. If we did even more, we would bring it further down. So we caused the peak, which was black line, to cut down, to come down as orange line. This is what is expected. This is what we have to do. So if that happens, there will be very few deaths and things would be a lot more in control, inshallah ta'ala. So that is why we are saying that next 3 months are very crucial, because we are coming to summer and we'll be starting off in autumn. So now autumn time things would start settling down, but there is a fear, that in autumn there'll be a second rise, a later peak. It is feared that Japan and Hong Kong and Taiwan may be in that category. So they had no issues yet, very subtle, very small scale problem. They may be having this time, which is the green line, and coming autumn time, it would just peak. But they are sensible enough to know, that they would prepare for it. How? With all hand hygiene, with everything else, plus the vaccination. The vaccination would come in the next few weeks, and they would have enough time to vaccinate everyone against this particular virus. Even if this peak goes ahead, they would have some time to sort it out. Now we do not have much time because we are only about 15 days in Pakistan away from Italy. In UK we are 15 days. No, sorry, UK is about 15 days behind Italy, and Pakistan about 15 days or 10 days behind UK. So we are all following the same trend. So we need to work hard now. Who needs to be screened? Who should be checking? If you have traveled to affected area, that is why at the airport they check you, they test you, and then they try to quarantine you. This making sure that you are completely fine, not causing any trouble to anyone else, and no trouble to yourself. And again, anyone who has a contact with someone who is less than 6 feet apart. Why? As I mentioned, the droplet you can throw up to that distance. Because when you sneeze out, it's not your sneeze power or the cough power, it's the droplet size that it gradually goes in the air and then slowly come up to 6 feet. And that is why we suggest putting and using the tissue papers to cover your mouth, cover your nose. Don't sneeze everywhere. But kids, we cannot control. Adults needs to be much more mature and sensible. What symptoms do you get? Normal cough and cold, really. So fever is the most important symptom. Anyone who gets fever and it is not going away, then they need to be a bit careful these days. I would suggest that anyone who has fever, which is new onset, they stay home. They do not go out at all. If someone doesn't have fever, could they still have COVID? Yes, they can have COVID without having fever, because about 30-40% people would not have fever. Some people do get a bit of tummy upset with diarrhea, nausea, some vomiting, but that's only 10% people. It's not a common thing. This particular symptom is called silent hypoxemia. It means the blood has not got enough oxygen, so you're deprived of oxygen inside. But because you are youngish, you're not in your 60s, you're not in your late 80s, so you are doing quite okay. But the fact that you're maybe resting and you're not manifesting that breathlessness yet. So if you do not have breathlessness, you still can do things, but you're tired, you've got a bit of temperature. This is the time that you are about to get into this trouble zone. You must stop there and then and get yourself sorted out. If you feel well, stay at home. So this is the typical course, how the disease would progress. If you look at that, this is what's going to happen to those 15 to 20% of people who are going to get the hit in a bad way. So by day 4, they would start getting a little bit of symptoms, because this is the incubation period. So they'll be fine, no symptom at all when they contracted it from someone who was coughing in the family or friend, and they did handshake or whatever. So they would have that for first 4 days, up to 7 days, up to even 14 days. They may not have any symptom, but they continue to shed it. But day 6, This is those 20% people who are going to get severe problem. Not the 80% which are going to be very well and they wouldn't have any trouble. They would sail through, stay at home, and most of the time they would not need any support from anyone other than some paracetamol, some rest, and some fluids. So day 6, they start getting a bit more breathless. So their breathlessness would start, which they already had because they had low oxygen, which was not manifesting itself because they were coping with it. So breathlessness would start, and they would seek medical help. And by the time the majority would come to hospital, it would be about day 8. And once they are admitted, they'd be staying there, and sometimes they would go on day 10 to ICU just for oxygen, some fluids, some drips, and some time for intubation. We come to that. These are the investigations that we as doctor would do, so you do not need to worry about that. I move on. Just to show you this particular CT scan, which is on the left side, you would see gray, dark color, nice heart sitting in the center. This is a normal scan. On the right side, if you look at that, there are at least left and the right, both top parts, you could see significant haziness, gray color. That is, and even on the bases or the bottom part of the left side of the screen or the right side of the screen, left lung but right side of the screen. Okay, the orientation. Anyway, so that is all the lung airways we call alveoli, the small sacs, small bags, small sac, which are filled with inflammatory cells because there's a fight going on in the body, a lot of rubble created, a lot of inflammation created. These airways get filled and oxygen cannot pass through those barriers, and patient would be very, very unwell, needing intubation straight away or high flow oxygen or humidified oxygen. I'm not going to talk about that because that's a completely different topic, how to manage these patients when they need intensive care. That's for doctors who work in ICU. But this is a very tricky situation. It happens within a day to 2 days time. So here he was fine. A couple of days time, there he goes. So if he does not get any support at that point, he is going to die. What medication, what tablets can you give these patients? There's no clear evidence on anything yet. There's no medicine that can cure guaranteed. There's nothing that would give us good support. But we try to support patients with many different things. One particular thing is a combination of these two medications. One is called hydroxychloroquine or chloroquine. They are the same malaria medication. Unfortunately, people think that we should just take it and we'll be fine. So people started storing it. And you know what? I found out that there's shortage of the medicine now. And this is extremely bad, the bad attitude. It is actually quite selfish because you do not need it. You would need it if you had infection. And when you need it, it wouldn't be you who decide it. It should be a doctor deciding it because you're so unwell to require that. We haven't got the data to suggest that it cures the disease. What it does, it may help reduce the level of virus. I show you the data in a second. So those who are unwell and those who have confirmed disease, when you have a cough, when you feel a bit cold, when you have sore throat, when you feel a bit feverish, and you stay at indoors and you feel that I may have it, but you haven't got confirmation. You do not need the tablet, and these tablets have side effects as well. So they do work in different ways, but that's not for common people, so we leave it here. It has some immunosuppressive properties as well. Hydroxychloroquine is much better than chloroquine, which is a malaria tablet. They both are used, but mainly chloroquine is the one that you use. And hydroxychloroquine is the one that people use for some skin condition. It's a very good one, but it has some side effects as well. All medication have some side effects. This recent data is hydroxychloroquine plus azithromycin. That's so far the best data that we have got, and we're hoping that it would help reducing the viral load or killing the virus in the body. So if you look at this graph, so there are three type of people. There's this black graph, black line going up and down. You could see these people, these patients, they were not given any medication. They didn't have any. Not that they didn't know, so they just given didn't give them. And this blue line, these are the people who were just given hydroxychloroquine alone. And the green line are the people who were given hydroxychloroquine plus azithromycin, the combination of those two medications. So this is an immunosuppression, anti-malarial, and this is antibacterial, the bacteria antibiotic. But they both have anti-inflammatory property, reducing the inflammation down and helping with that ACE2 receptor. So the data suggests, this is France study, that about day 3 or what, you nearly about day 2 or 3, the level start going down. This is the blood results, the test that we do, the sample that we take from them, the PCR that we do on their nose sample. That would turn out to be within 2 to 3 days negative. And day 5 will be completely zero. And it stayed to day 6 like this. Means the virus has not got any existence inside the body. So as if you've killed the bacteria and the virus. So bacteria, because this is antibiotic, but you've also killed the virus as well, one way or the other. This is very early data. We do not know exactly, is it going to last for long, how long to continue with those medication, who to give this medication. It could just be a good thought. It could be something as an option, but unfortunately people have bought those medication and there's none left for healthcare professional to prescribe to the right people. And that is what happened as people start panicking when they buy everything, whatever they need, whether they need it or not. That is a very bad thing. And there are different doses and different ways of using it, and there is particular contraindication to these medications. Someone who has got epilepsy, that they shouldn't be using hydroxychloroquine. Means the fits. Someone who has got heart condition, irregular heart rhythm, they should be asking doctors before they take it. And there are many other conditions they shouldn't be use this medication in unless a doctor advises or suggests you. And these are the side effects as well. Sometimes you can get your heart not functioning properly. So if you have the disease, which is COVID disease, coronavirus, affecting your heart, and you take the medication which is affecting your heart, what is the chance that you would come out very easily? So that is why don't go and behave abnormally. Just do the right thing, ask the right people. This particular medication is not been available yet. It is just on a trial basis, but there is some data to suggest this is good. It worked in MERS, but still not available yet. Sometime it may be given on a compassionate basis. Vitamin C, people are trying and eating and making it their regular food, which is another unfortunate thing, because there's significant contention. The data is not robust enough to support that vitamin C would help these patients. Since we do not have any alternative, nothing else to support, giving intravenous vitamin C in high doses, good doses actually, 1.5 grams every 6 hours, which is 4 times a day. And you give thiamine with that, so it is safe dose and it might help. And no one knows whether it does, but there is a possibility that it may help. So people are trying this as well. But for you to continue to have it on your own, whether it works or not, there's no clear proof for that. But don't go overboard with that. Have a little bit maybe if you wanted to. The other medication don't work, antiviral. This Tamiflu, there's some suggestion that if you wanted to take it as WHO suggested, but there's no data that it would work. So what is the prognosis? Prognosis means how many people would survive and how would they be? Obviously, hospitalization is a problem, because if you needed hospitalization, you are really very bad. You would be really struggling. So about 80% of people would not have any trouble. They would just sail through without needing any hospitalization. So that is why you do not even call your doctor. You stay at home. If you're well clinically, other than cough, cold, and fever, just stay at home. So, as I said, 10 to 20% of people would be admitted to ICU. 3 to 10% of these patients would require, means half of those would require intubation, camera, which is the tube going into your airway, and you require ventilation as well. So, mechanical ventilator. So, they are on ventilator now. And half of those about there would die. So, even the ventilator and the ventilated patient might not be able to make it. We do not know. Those who would make it, another 5%, 7% people, when they come out of ICU, would they be well enough to lead a normal life? Would they have completely scarred lung? Would they need a lot of support? When they wake up, would they be good enough to live like a normal person? How much disability they would have, that's to be seen. No one knows because we haven't gone there yet. So there are certain blood tests, certain things that are found in the blood which suggest poor prognosis, but that's for doctors. So the advice for hospital, from hospital point of view, is that do not turn up to A&E. Do not go to A&E if you're suspecting and you're anxious. You need to stay at home because you're not doing any favors to anyone. You actually cause more trouble to yourself and to others. If you have it, you're passing it to many other people. No one is going to admit you to hospital regardless. Whatever you have, whatever concerns you have, you will be pushed back home. Remain indoors. Believe you me, we do sit in A&E. I'll be on call again on Friday, and then on Sunday, if I see you in A&E, you're just going home without me even waving at you. So you would not be admitted unless you have significant problems, which we would know automatically just by looking at you. So don't think that you can, you're wasting everyone's time and resources and causing more trouble. So please, please stay at home. Don't come out from your homes. And those who would come out and come to A&E, vast majority would send them home, as I said. And those who understand, those who are fine, even if they have confirmed diagnosis, they can still be able to go home. We send them home. What does Public Health England advice says? That you should stay at home. If you have the infection, if you have the symptom, so symptoms of cough, fever, cold, sore throat, sneezing, runny eyes, runny nose, itchy eyes, itchy nose. So any of that sort, we feel like, it's just causing me some trouble. I'm having cold symptoms. Obviously, itching could be due to allergy, but normally you might just feel like not good. I think everyone has some sort of cold or flu in their life, so they know what it feels like. If you're feeling that way, just don't worry, don't bother, stay home. So isolate yourself for 7 days. And if you need any help, you can contact 111. That's the number for people in UK. And if you think that you need some help, you can call 111 and get some help, and they would advise you what to do. For yourself, you just drink plenty of water. You need to drink enough water to make sure that your urine is pale yellow. It is not dark at all. It is not thick. It is very sort of water color, like straw color, hot, very, very mild. So you should be drinking a lot of water. And paracetamol, take it 2 tablets, which is 500 milligrams each, so a gram up to 4 times a day. Don't use ibuprofen, Nurofen, Brufen, diclofenac. Those medications, there is some suggestion that they are harmful for patients who if they had it. So NSAIDs of any sort, non-steroidals, anti-inflammatories, they are not good for you. So don't use them at all. Do not exceed the limit, which I already mentioned, about 8 tablets a day of paracetamol. You can use same thing as Tylenol and many other similar medication you can use. Washing your hands. This is perhaps the most important activity you could do indoors. Wash your hands every so often, 20 seconds minimum, with soap and hot water, warm water. If you have coughed up, sneezed, you blew your nose, just use it. Do it. If you do not have access to water, then you can use sanitizers, but they're not the best. Water and soap is the best thing. For 20 seconds, you must try your best. Try all the small bits and the crevices and the spaces in between the fingers and use all of those nicely, properly done hand wash. Whenever you're coughing, since you're symptomatic, it may be COVID, you put tissue paper on. If you do not have that, then on your sleeves. Do not spread your cough or sneeze in the air. And whenever you get access to sanitizing gel or water, wash it, clean it, remove all the dusty stuff, all the clean, all the particles that you might have sneezed on. That surface needs to be cleaned as well. If you live with someone else and you got the symptoms and you're the first person who had this in the family, so 7 day time, after 7 days, you have to stay for 7 days indoors. And others in the family, your missus, your children, whoever, they have to stay indoors for 14 days. For 14 days, because they did not have any symptoms. Those who do not have any symptoms and they come across someone who had this particular disease, then they must stay at home for 14 days. And this 14-day period would start from the day the first person in the family had that symptom. When he had this sign of infection. For example, imagine someone had today, Sunday the 22nd of March, if someone had symptoms of cold, flu, and he limited himself, he isolated himself, he stays indoors. Now his wife, his children, they are completely fine. He needs to stay for 7 days. He cannot go out until next Sunday. So he must be like this. Family remains okay. They haven't got any symptom. 7 days passed. Family needs to stay for another 7 days. So they need to stay for good 14 days from the day. So now, your family may be abroad and they came to see you on day 5 or whatever. They need to stay for total of 14 days when you started your symptoms. It will still be from this Sunday, 2 weeks' time. 2 weeks' time on Sunday. 2 weeks on Sunday. Whether they come now or they came a bit later, unless they had symptoms. So if they got the symptom, so say on day 6, 7 they turn up, 5 they turn up, and 2 days later they started having symptoms. They have to then have their 7 days started. It sounds a bit complicated, but it's really straightforward. If you get stuck, then give a call to 111, then they would explain. So for anyone else in the household who started displaying symptoms, they need to stay at home for 7 days, starting from the symptoms, when the symptom started. Okay, so if it was say day 13, someone developed that, and they were staying at home on day 13, and on that day they started having some cough. It was the last day of their quarantine, but then they need to stay indoors for further 7 days. Remember that. And people obviously would infect each other. That is why 14-day period is being taken. It would definitely reduce the level of infectivity, and people will be much more, safe. Now, if you have someone in the house and that particular individual is vulnerable ones are the ones that I mentioned before, those who have diabetes, lung condition, heart condition, and those who have high blood pressure, old age. These are people who need to be supported as well. So if you got it and you are isolating yourself inside the house, try to get them out of the house to someone else as a friend or family. So mother can go to daughter's house, mother can go to other brother's house. So she is not in contact with you because we want to save those elderly people, those vulnerable people, because they are not going to fare very well. Okay, so however long your symptoms, yours would be with the symptoms, 7 days, you need to make sure that those who you could send out, they stay out. If you cannot do that, then obviously try to stay away from them as much as possible. And any help, try to live like a community. We should do that anyway, but this is the time when we need it most. Help each other out. Ask the neighbors. Find out what's happening. Do they need anything? Get food. Get whatever they need. Support each other out. Don't go out unnecessarily unless you really need to go out. And if you cannot cope with your even simple symptom, call 111. They will advise you what to do. But obviously, if you get breathlessness, that's a different matter. Then you would call 111, but they would advise you to come to hospital. You need to plan ahead, really, to adapt your lifestyle. It's going to be staying indoors for 2 weeks or 1 week. It's not easy for most people. So have a bit of chit chat, support each other. And if you share kitchen, bathroom, and sitting areas, then keep all those spaces very well ventilated. Keep yourself away from that vulnerable person for 2 meters, which is about 3 steps. Make them sleep in a different room. Make sure that everything's separated. The towels, get them to dry themselves before you come close to them. They should make sure that they've got good hygiene. You can, if you share the toilet and bathroom, it is very important that you clean every time you use it. Use wipes, and this is for the people who have infection. One person having infection, then all the family needs to be taken care of. One thing could be that you decide on a rota. So this is the time I would go in the morning, you would go in the afternoon, or this time or that time. Sometimes might help a bit. So vulnerable people can go to the toilet, sit on the toilet seat earlier, and they come out in the back in their room. They go to kitchen and back in their room. So you go after them. So do not use toilet before them. So because you have infection, you have sat on that toilet seat, you have used the tap, you've used the door or the handle of the door. So rather than you doing it and causing virus to be spread everywhere and then they're coming and picking it up, you do the other way. Let them go and use it on a daily basis first. And once you have done, you then come out and clean it, wipe it. For those who have infection, I'm not talking about when you do not have any symptoms. I told you you're staying completely fine indoors. No one has any symptom. Don't panic. You do not need to do it. It is for those who have this infection. Any one person in the family who may have infection, coughing, symptoms, fever, that sort of people. As I said, separate your cutlery, separate your crockery, separate everything. Use your clothes differently at a different time, not mixing with their clothes. It would be very difficult, obviously, but you have to do your best in order to avoid any disaster indoors. No problem with breastfeeding. There's no data to suggest that, so don't worry about that. It's much important that babies are fed properly rather than avoiding all that contact if you happen to have infection. Now, your disposal of the waste and cleaning yourself. What would you do with those? Use detergent, bleach, getting rid of all the viruses on the surfaces, and handrails, as I mentioned, mm, you know, handles and remote controls, laptops, your mobile phone, all those gadgets. Everything needs to be wiped clearly if one has this particular disease. So your tissue papers that you've used, how would you dispose them? You're not going to put them in the same bin. Whatever you use, that should go in a separate rubbish bag. And that bag then, once it's tied, filled up, it goes in a different, another bag, and then tied again, and then you keep it separate. And you keep it for at least 72 hours without moving it, without, let it be there before it goes out in the main bin for the collector to collect in the morning. You do not put it straight there. So there has to be two bags, and then final bag when they need to go in the waste bin outside. Rest of this stuff could be done properly. So it's mostly to do with the tissue papers, wipes, and cleaning clothes. What about laundry? So when you're taking laundry out from the dirty laundry place, whatever that may be, a basket or something, don't shake them. Just put them straight where they need to go. Keep it good temperature, 60-degree minimum. If you do not have washing machine, then wait for 72 hours. After your 7-day period of isolation is completed, or if you were completely asymptomatic, then 14 days. After that, 3 more days, and then send those clothes to the laundry for public laundrette, wherever you want to wash it in. So let me repeat it again. So if you, for your own clothing, you keep it completely separate and wash it separately. If you do not have that and you want to go to public laundry, then you must, after your isolation period ends, which is either 7 days or 14 days. 7 days when you have the symptoms, 14 days when you never had the symptoms but you have been in contact with someone who had the symptom, then you, in the household, then you stay indoors for 14 days. After that, then you spend 3 more days leaving the clothes where they are. You can go out, but the clothes stay where they should be, in a bag or in the basket, and then send it for washing to public laundry. You're staying indoors, so make sure that you have got some activities, especially for kids. You do not get completely crazy about being on your own, pulling each other's hair. Few questions that people ask. Do I need to get tested if I have infection or my family? You do not need to. No one who is well needs testing for the virus, because for one, it takes time to get back. It is a waste of resources, a waste of everyone else's time and exposure to many things. If you're well, you do not need anything. You just stay at home, let it pass, because you are likely to be those people who have milder disease. So don't worry about yourself at all or the family, but stay indoors. With regards to testing, obviously you would worry about your family. With regards to testing, that's what I mean. Face mask, do I need to put face mask on? You do not need to have your face mask on at all, unless you are in a clinical setting, you are in hospital, you're seeing patients, you're a doctor. Otherwise, it doesn't work. So most important thing is, do not go out and wash your hands. Visitors not allowed at all. No visitors at all. Do not let anyone coming to see you. You must have seen this particular uh, uh, tweet or message from Prime Minister as well. Very sensible thing. Do not go and visit your mothers on Mother's Day. Your Mother's Day's best gift is that you stay away from her, because if you are harboring that virus, you're going to pass it on to her on Mother's Day, and she might not pull through. So your best gift would be to stay away. Yeah, call her. on a daily basis for hours. If you're staying indoors and she's staying indoors, why not? So have chit chat, have FaceTime, have Skype, but no visiting at all. Unfortunately, people think this is holiday, have fun, do this and that. Kids want to, but they're getting bored. Let's go out. That is not on. They would cause more trouble to you and to the family and to everyone else. So do not go out at all. You do not go to your in-laws or in your parents' house over the weekend as your normal habit. Leave that in the next 2 to 3 months actually, until we are over all of this. As I said about autumn time. So this is your proper respite. Be in your itikaf. Itikaf with Quran, itikaf with Allah subhanahu wa ta'ala. Reflection, thinking about what if we come to an end? What if we could not contain it? What if this is the first sign of end of time anyway? So we know it can happen. So just prepare for that, work for that, rather than panicking. Obviously, if you have any carers coming in, they would continue, but make sure that they have face masks, make sure that they have gloves if you have infection. And likewise, there's no data to support that animals get any problem with this, so they are quite okay. When would you come out of isolation? I mentioned it, I'm just mentioning it again that it has to be 7 days if you were symptomatic. If you were not symptomatic, then 14 days. The 7 day period start from the day when you first became unwell. Okay, not from, you do not say, oh, let me just count 2 days of my time when I was completely well because it could have been there for 3, 4 days. Don't guesstimate there. The day you started cough or fever or sore throat, that is the day one, and then you continue for 7 days, and then you come out. 14 days, you know if all the household members were fine because they did not have any symptom, you had the symptom. And I mentioned it before, the 14 days start when you first had the symptom, not when they come and see you, when they visited you. If they live with you, then they have to be just 14 days. And the reason is, as I said, incubation period for coronavirus could be up to 14 days, and they may get symptom after 14 or on 14th day. Okay. If the first person who was unwell after 7 days feels completely fine, no temperature, he can de-isolate himself. He can come out of his isolation. If someone becomes unwell during that period, I'm just repeating it again, during the 14-day household isolation period, they would follow the same advice because now they became unwell. So this is symptomatic person. It would last for 7 days. So there has to be a 7 day period before they can come out of the hospital. It doesn't matter if it comes earlier or later for the 2 week period. So it works both ways. For example, someone had this virus symptoms, so he's staying indoors for 7 days. The family or someone in the family is coming in contact with that person. They need to be there for 2 weeks. But on day three, this particular family member developed the symptoms as well. So now he just need to be for 7 days and they'll be fine. Once they are after 7 days well enough, no symptoms, you would continue to have, by the way, small amount of cough, little trickly cough, little ticklish, mild cough, which stays there, which I would talk about in a second. Keep saying the same thing, just making sure that people are aware of all the nitty gritty of this. The cough may persist for up to few weeks, even up to 6 months. And that would be a very mild, dry type cough. It is because the nerve endings get rawed due to the inflammation, due to the cough, and every time you breathe in and out, it feels that there's something happening. Cough is actually a defense mechanism. It's body's way of telling us that there's something trying to come close to the lungs. So that is why you continue to have that irritated or irritating cough. Don't worry about that. As long as you do not have fever, as long as you're not breathless and you are feeling otherwise quite okay. Some people say it does not transmit in hot climate. No, it does in every climate. It has no problem. There are significant cases in Australia as well even now. So you have to do the same thing. What about cold weather and snow? There's no reason to believe that very cold weather would kill it. If it snows, no, there's no data, nothing. Shall we just make ourselves very hot, taking a hot bath? Don't do that. It may scald your skin. Mosquito bite, there's no evidence that mosquito bites can transmit the disease, but one should be sensible enough to avoid mosquito bite because you may get malaria or other infections. Hand dryer, should we dry our hands with that rather than towel or something else? No, it doesn't help. You just wash with water and soap or alcohol-based hand rubs. Dry thoroughly with the towel paper and or just maybe warm it. Can we use ultraviolet disinfection lamps? Doesn't work. What about thermal scanners? It wouldn't tell you whether you have COVID-19 or not. It may tell you that you have temperature, which you should know anyway generally. Shall we not spray alcohol and chlorine all over our body? Definitely not. Because spraying all over the body would not kill it, which has entered inside the body. Because we are not talking about the virus which is inside the body. We're talking about the virus which is outside in order to not transmit. It would just it would obviously kill those who are on your hand and on your body, but you already got the virus multiplying inside the body, and you would continue to cough it out. So just use the normal soap. Don't become over anxious about this. And spraying would definitely cause you to have something coming to your eyes and mucous membranes, and that may be dangerous as well. So it is very good for the surfaces, but not for cleaning your body. Shall we get pneumonia vaccine? It doesn't help. This is a bacterial vaccine. It doesn't help your virus. But you can do that if you have other problems for prevention of bacterial pneumonia, which people do every few years, 5 to 10 to 15 years, depending on the underlying conditions. So we rinse our nose regularly with saline, warm water, salt water. Limited evidence that it may help in common cold. It shorten the recovery period, means you get better quickly. But this is for common cold. This is coronavirus, which is different. With the behavior, it is completely different actually. Garlic, there's no evidence that would work, but one can have healthy food, and garlic tends to be good anyway. So if you wanted to have it, there's no harm. The younger people, yeah, they can get affected, as I said, but obviously they're a little bit less at risk of getting severe disease, but they should be careful because they are going to be a reservoir of a virus and passing on to others. So we take any antibiotics on a regular basis. This is a virus which is not killed by antibiotics. As if you have the doubt that why we are giving azithromycin, which is a bacteria killing antibiotics, because antibiotics means antibacterial medication. So that is not for bacteria killing reason, but rather for anti-inflammatory property, which that particular antibiotic has. So don't use antibiotic as prevention. If you get antibiotic from the doctor, that is not for the virus, but rather you had a secondary infection from the bacteria, the opportunistic bacteria. You are getting that treated through that antibiotic. So don't confuse that. Mask we've already mentioned. You do not need to wear mask if you are well, but obviously if you're going out about meetings and other people where you suspect, it's sensible to use it for that reason. Or if you're caring for someone who has this condition, generally it is not recommended. If you have symptoms, cough and sneezing, then you must wear it in order to avoid the spread. And it is going to be helpful if you really wash your hands as well. There's no point putting mask on and then using no water or no alcohol swabs. So you must learn when to take it off and how to use it because there are certain problems with that. So this is a good poster that I saw today. It was nicely done by someone. I just nicked that from there, plagiarized it. Well, most of the data is plagiarized from different places, but this is the time when we need it all to use all those measures. Very, very simplified way of telling that we should be washing our vegetables properly, for example. Phone, keyboard, remote control, they get contaminated, so make sure that we wash them, we use wipes on them. Hand hygiene is very important, cleaning very nicely, thoroughly, behind the knuckles and between the webs and fingers and, the nail area. So make sure we do all that. The maid coming, make sure that they tell them to not uh, touch the door, but rather if she has touched it, she should come in and then uh, wash her hands as well before doing anything else. Yeah, I think this is good advice and do anything. This is another one I found quite helpful to explain how we break the chain, why we're saying all that. Because the most important thing is to break the chain. So this is a cartoon. I think it's actually a video. So you see, if you lit this one, the first one, it would continue to go to the next till you break the chain. So if one matchstick came out, as this guy came out, the fire stayed where it was. So if you continue to provide food and substrate for the virus, it would continue to multiply. You want to avoid that, minimize it, keep it contained there and then, and body would take over this. Body has the potential, but most of the time, the effect is so severe that by the time body manages to control it, it's too late. That is why the 20% people would need, or about 10% people would need some ventilating support or oxygen support, some other support in the hospital in order to make sure that they survive that difficult time when the body is trying to control the virus. Once they've done it, they would sail through, they'd be fine. Most people would be. So we have to limit it. Otherwise, it will continue to grow exponentially. As I said, one person infecting 3 people is not going to stop. So there is a potential that it would come back in vengeance if we do not take it seriously. Now, some people think, you know what, this is the qadr of Allah, so we leave it. Don't do that. Some people think, oh, there is some conspiracy going on. It has just been created. Whether someone created or not, that's not the discussion. The discussion is how do we look after our body. Rasulullah sallallahu alaihi wasallam, his teaching are such that we have to look after our lives. وَلِجَسَدِكَ عَلَيْكَ حَقٌّ, and you have the right over your own self, means your body has right over you as well, so you must give that right to your body. So when you're tired, you have to rest. When you're sick, you must take medicine. When you are about to get sick, there's a potential, stay away. It's called daf'i madarra. You have to repel the harm. You have to do jalbi manfa'a. You have to attract, you have to take, pull all the good goodnesses, all the well-being stuff, things that would make you strong. So take all those precautions and measures in order to look after the body that Allah has given you, in order to help others in the community, in the society, in the whole country, in the whole world. Because you may be thinking, I don't care. I would rather die as a shaheed, because dying in a disease like this, which is contagious, which is pandemic, which is everywhere in the world, there's a hadith to suggest that, like ta'un, like plague, that you would die as a shaheed. So I would rather die as a shaheed, as a martyr. That is not the right understanding in this particular case, especially because you are, inshallah ta'ala, if you survive, that's perfect. If you do not, you will be, inshallah ta'ala, getting the reward of being a shaheed. We do not deny that. That's hadith of Rasulullah sallallahu alaihi wasallam. But did Rasulullah sallallahu alaihi wasallam ask people to go and spend time with those who have plague? No, rather he said, do not go to the places where there is ta'un. So we're not saying that we can stop it. We are trying to do what Allah and Messenger of Allah sallallahu alaihi wasallam advise us to do. In this particular case, in this virus pandemic, the issue is more to do with saving others. If you want to lay your life, inshallah ta'ala, for the sake of Allah, I have you tawakkul, everything, no problem. But don't cause other to suffer for your reasons, for your ideas and thoughts, because ulama, muftiyan karam, aimma, they would never say that. They know what to do, alhamdulillah. So you have got scholars and muftiyan karam who are telling you what to do. Stick with that, and inshallah ta'ala, Allah will reward you. So what are the take-home message? It's spreading very quickly. It's going to peak in the next few weeks. As I said, we are about 10 days now away, 10 to 12 days away from Italy. We're following the steps. UK is following the footsteps of Italy. We're having the same trend. And Pakistan is 10, 15 days away from UK. We're following the same trend. And likewise, many other countries. So be on your guard. May Allah save us all from all the calamity. May Allah save all Muslim and non-Muslim alike. May Allah make us all working for each other, helping each other out as a brother, brother in humanity. As I said, 20% people will be hit hard, so be very careful for them. Do not give them any trouble through your lazy act or some lack of understanding. Physical contact and minimizing that is the only human intervention. I'm not saying that Allah subhanahu wa ta'ala can do any miracle. Allah subhanahu wa ta'ala through du'as, and du'as are absolutely necessary. These are the ultimate thing. Connecting with Allah subhanahu wa ta'ala, istighfar is the only thing, to be honest, that would help us. Allah subhanahu wa ta'ala would change the affair if we continue to be doing istighfar. That is why Allah subhanahu wa ta'ala says that Allah is not going to punish them while you are among them. And Allah is not going to punish them until they continue to do istighfar. So since we stopped doing istighfar, that is why we're getting this trouble time, punishment, problem, whatever. We need to repent back to Allah subhanahu wa ta'ala, make our ways better, and repenting include that we do not cause harm to others. If you want to harm yourself, even that is not okay, but that may be your choice. When you harm others, you are not allowed to do so. Rasulullah sallallahu alaihi wasallam actually said that if you have certain bad smell, you shouldn't be coming to the masjid after eating a a specific type of onion or garlic. You shouldn't be coming to the masjid because you're going to harm angels. You're going to harm person next to you. So we cannot harm others. So al-Muslimu man salima al-Muslimuna min lisanihi wa yadihi. Here, through my handshake, if someone else is getting the infection, am I really serving the Sharia? Am I really being obedient servant of Allah subhanahu wa ta'ala? Clearly not. We have to be very clear on that. And so Allah subhanahu wa ta'ala would do what Allah would want to do. Allah is, yaf'alu ma yasha. He does whatever He wants. But humanly, whatever Allah advises as a human being, we are doing that, inshallah ta'ala. This is the best way. Minimizing the contact, minimizing any soiling of hands, by contaminating our hands, by touching, going in places and mixing with people. Wash our hands properly, inshallah. Allah, work together, trust in Allah subhanahu wa ta'ala. May Allah give us tawfiq. أقول قولي هذا واستغفر الله لي ولكم ولسائر المسلمين فاستغفروه إنه هو الغفور الرحيم.